Hodgkin lymphoma (HL) in teenagers and young adults is a significant concern due to the unique aspects of this age group, including the impact of treatment on growth and development, the potential for long-term effects, and the psychosocial aspects of dealing with cancer at a young age. Overview: Hodgkin lymphoma is a type of cancer that starts in a lymphatic system, which is a part of the immune system. It's characterized by the presence of Reed-Sternberg cells. In teenagers and young adults, HL is often diagnosed in its early stages, and the treatment approaches can be highly effective. Types: Classical Hodgkin lymphoma (CHL), nodular sclerosis, most common subtype in this age group, often presenting with large, hard lymph nodes. Mixed cellularity, features a mix of Reed-Sternberg cells and other immune cells. Lymphocyte-rich, contains a higher number of lymphocytes relative to Reed-Sternberg cells. Lymphocyte-depleted, less common and more aggressive, with fewer lymphocytes and more Reed-Sternberg cells. Nodular lymphocyte predominant Hodgkin lymphoma and LPHL, characterized by popcorn cells and often has a better prognosis compared to classical subtypes. Symptoms of Hodgkin lymphoma in teenagers and young adults can include swollen lymph nodes, painless swelling in the neck, armpits, or groin, fever, persistent or recurrent fever not related to other infections, night sweats, excessive sweating at night, weight loss, unexplained weight loss or significant reduction in body weight, fatigue, persistent tiredness or weakness, itchy skin, general itching or rash, although this is less common, pain, occasionally, pain in the lymph nodes after alcohol consumption. Diagnosis involves several steps. Physical examination, assessment of symptoms and physical signs, such as swollen lymph nodes, imaging tests, chest X-ray, to detect enlarged lymph nodes or tumors in the chest. CT scan, provides detailed cross-sectional images to evaluate the extent of the disease. PET scan, helps in assessing the activity of the disease and identifying areas of spread. Biopsy, excisional biopsy, removal of an entire lymph node or part of it for examination. Core needle biopsy, removal of a small tissue sample for analysis. Bone marrow biopsy, to check if a lymphoma has spread to the bone marrow. Laboratory tests, blood tests, to evaluate overall health and detect anemia or other abnormalities. Staging, the staging system helps determine the extent of the disease. Stage I, involves a single lymph node region or a single extra lymphatic site. Stage II, involves two or more lymph node regions on the same side of the diaphragm or localized involvement of an extra lymphatic site. Stage III, involves lymph nodes on both sides of the diaphragm, possibly including the spleen. Stage IV, involves widespread disease in one or more extra lymphatic organs, e.g., liver, bone marrow. Treatment approaches for Hodgkin lymphoma in teenagers and young adults generally include chemotherapy, the main treatment modality, often involving a combination of drugs such as ABV, adriamycin, bleomycin, vinblastine, dacarbazine. The regimen may be adjusted based on the stage and response to treatment. Radiation therapy, used to target specific areas, especially for early-stage disease or residual disease after chemotherapy. Modern approaches aim to minimize long-term side effects. Stem cell transplant. Autologous stem cell transplant, uses the patient's own stem cells to restore bone marrow after high-dose chemotherapy. Allogeneic stem cell transplant, uses stem cells from a donor, considered for relapse or resistant cases. Targeted therapy. Drugs like brentuximab vedotin target specific cancer cells and are used for certain cases or relapsed disease. Immunotherapy. Emerging treatments that harness the body's immune system to fight cancer, such as checkpoint inhibitors, e.g., pembrolizumab, nivolumab. Prognosis: early stage Hodgkin lymphoma generally has a high cure rate with appropriate treatment. Advanced stage Hodgkin lymphoma, the prognosis remains favorable with modern treatments, although outcomes vary based on individual factors. Follow-up care: regular monitoring, ongoing check-ups and imaging studies to monitor for recurrence or late effects. Managing side effects: addressing any side effects from treatment, including managing physical, psychological, and developmental issues. Long-term surveillance, monitoring for late effects of treatment such as cardiovascular issues or secondary cancers. Psychosocial support, providing emotional and psychological support for the teenager or young adult and their family throughout treatment and recovery. Conclusion: Hodgkin lymphoma in teenagers and young adults is generally treatable, with a good prognosis, particularly in early stages. Treatment plans are tailored to the individual's needs and may involve a multidisciplinary team. Early diagnosis and comprehensive care, including addressing both the medical and psychosocial aspects of the illness, are essential for achieving the best outcomes.